She looked right at me and smiled. Not a confused smile, not a pain medication smile, a real clear, I know exactly where I am smile. And then she said, calm as anything, "Do you hear that? The bells. They're so beautiful." There were no bells. There were never any bells. I'm going to tell you about 4 patients, 4 totally unrelated people, different ages, different diseases, different families, and every single one of them in their last few hours said the exact same thing. I've been sitting with this for years, and I still don't have a clean answer. I'm not sure one exists. I'm Nurse Raines, 20 years in. I've done the ER, where everything happens fast and loud and somebody's always yelling something across the room. I've done the ICU night shift, where the monitors just never stop and you run on bad coffee and adrenaline. I did a stretch in the psych ward that I'll save for another video because, wow. And then I landed in hospice. Hospice changes you, not in a dark way, in a quiet way. You learn that dying has its own rhythm, its own language, and sometimes, not always, but sometimes, its own sounds. I want to paint this for you because the setting matters. Hospice is nothing like what you've seen on TV. There's no chaos, no one's running. It smells like warm laundry and a little bit of lotion. The aides use this lightly scented stuff when they reposition patients every couple of hours just to keep them comfortable. Some sections have carpet. The lights are turned down low, and in almost every room, there's a family member asleep in a recliner in the corner with a paper coffee cup tipped over on the table next to them. It's quiet. A TV on low somewhere down the hall, the soft, steady sound of a morphine pump doing its job. That's the machine that keeps a slow drip of pain medication going so the patient isn't suffering. Maybe a monitor beeping once in a while, people talking in the hallway like they're in a library. No bells, okay? I need you to hold on to that. 2 years on that floor, and I never once heard a bell. Not from outside. We were sandwiched between a strip mall and a storage unit place, not exactly church country. Not from inside. Our call system made a soft chime at the nurse's station, not in the rooms. No wind chimes in the courtyard, nothing hanging in any window. No bells. Anywhere. Which is exactly what makes this so hard to explain. The first patient, I'll call her Margaret, 81. End-stage ovarian cancer. Her daughter Patrice had barely gone home in 4 days, sleeping in that recliner, running to the vending machine, coming right back. Margaret had been what we call minimally responsive for about 2 days. She wasn't waking up, wasn't tracking us with her eyes, wasn't squeezing hands, just breathing. And that breathing had gotten slow and uneven, with these long pauses in between that make the family go completely still, because every pause feels like it could be the last one. I went in to check on her, repositioned her a little, looked at her skin, made sure the morphine pump was running right, and I was talking to her the whole time the way we always do, low and easy, because we believe people can still hear you even when they can't respond. I was fixing her pillow when Margaret opened her eyes. Not halfway, not that foggy, half-there flutter, all the way, completely clear. Patrice shot up out of that recliner like someone grabbed her. Margaret didn't look at me, didn't look at her daughter. She looked straight up at the ceiling. And her face, I've replayed this so many times, her face just released, like every muscle that had been bracing for weeks finally quit all at once. And she said, real soft, "Those bells, aren't they lovely?" Patrice goes, "Mom, what bells, Mom?" And Margaret smiled. I mean, really smiled. The kind you see on someone's face when an old song comes on and takes them somewhere good. She said, "Like Christmas, but softer, so much softer." And then her eyes closed again. I checked her medications, everything in normal range, nothing that would cause that. I stepped out into the hallway and just stood there, listened hard. Nothing. The HVAC humming, a TV somewhere. That's it. I went back to the nurse's station and wrote it up the way I write everything, just the facts. Patient briefly responsive, reported hearing bells, seemed calm, returned to minimal responsiveness. Margaret died at 4:17 in the morning, about 6 hours after the bells. Now, here's where my head was. I'm a nurse. I spent years in environments where if you can't explain something clinically, you keep looking until you can. My first move is always the physiological answer. What's the brain doing? What's the meds doing? What's the oxygen situation? And the truth is, when someone is actively dying, the brain goes through real documented changes. Blood flow shifts, oxygen drops. The brain can produce experiences that aren't coming from outside. Sounds, visions, feelings. There's research on this. It has names. Terminal lucidity, end-of-life experiences. Hospice nurses and researchers talk about this stuff all the time. So I landed on her brain did that, a little window of clarity right at the end, and what her mind gave her were bells, comfort, something beautiful on the way out. I told myself that story for about 4 months. Second patient, I'll call him Roland, 74, retired mechanic, the kind of guy with permanently stained hands and zero patience for overthinking anything. His diagnosis was congestive heart failure. Even walking across the room became too much. He'd been with us 11 days when it happened. He was actually awake that afternoon, more alert than he'd been in a couple days. I came in to check his vitals, heart rate, blood pressure, breathing, oxygen level. He was watching me work. And then he looked past me, toward the window, and he tilted his head, slowly, like he was trying to pick up a sound from far away. June noticed. She said, "What is it, Roland?" He goes, "You don't hear that?" She said, "Hear what, honey?" He looked almost like he thought it was funny that we couldn't hear it. He said, "Wind chimes, nice ones." Then he paused and said, "Sounds like heaven." And then he just turned back to me and asked if his son had gotten back yet. I checked the window, closed. February, nothing outside. I asked the aide to walk the hallway. She didn't hear anything unusual. Rowan died 14 hours later, in his sleep, peaceful, with June holding his hand. When I brought it up to her afterward, gently, she cried. And she looked at me and said, "He was the least fanciful man I have ever known. 38 years. He never once said anything like that in his life." 2 patients, same thing, completely unrelated, and I hadn't told a single person yet. Dolores was 67. She had ALS. She'd been fighting it for 3 years, and from everything her family said, she'd fought it like it personally offended her. Her room had a whole corkboard covered in photos, grandkids, a lake house down south, a big goofy dog she clearly adored. I came in during a harder afternoon, and the second I walked in, she reached out and grabbed my wrist. Not panicked, steady actually. She looked at me, eyes completely clear, and she said slowly, "There are bells outside." I said, "Let me go check." She shook her head. "No." And then she said, "They're for me." I just held her hand for a minute, and then I asked her, "Are they pretty?" She closed her eyes and said, "Yes, they are." I wrote my notes, finished my shift, walked out to my car, and I just sat there, 20 minutes. Not scared, I want to be clear about that. It was something else. It was the certainty in her voice. There for me. There was no confusion in it, no fear. She knew exactly what she was saying. Dolores died the next morning. Her daughter told me it was the most peaceful night she'd had in months. His name was Thomas, 80 years old, retired history teacher, 35 years in the classroom, sharp as anything even at the end. He'd been quiet most of the day. I came in late afternoon just to sit with him for a bit. Sometimes that's the whole job, just being in the room so somebody isn't alone. He opened his eyes and looked right at me, and he said, "You've heard it before, haven't you?" Not a question. I said, "Heard what, Thomas?" He said, "The bells. You've seen this before." I didn't want to say too much, so I said, "Some patients have mentioned hearing something beautiful near the end." He nodded, real slow, like I'd just confirmed something he'd already worked out on his own, and he said, "Then it's real. I knew it was real." Closed his eyes. He died that evening just after 7. His daughter said he looked like he was listening to something. 4 patients, 2 years, nothing connecting them except a ward, a nurse, and the same impossible thing at the end. I don't know what they heard, that's the honest answer, and I'm sticking to it. But here's what I do know. Every single one of them got calmer after. Every one. Whatever those bells were, something the brain made, something that came from somewhere we don't have a way to measure, it showed up at exactly the right moment. And they weren't scared, they weren't confused, they were ready. Thomas said it was real because I'd seen it before, and I've thought about that a lot. I think what mattered to him wasn't proving it scientifically, it was knowing someone else had witnessed it, that somebody had been in the room and paid attention and was going to carry it forward. If you've sat in one of those recliners in the corner of a room just like that, watching someone you love breathe in that slow, uneven way, waiting through every long pause, you already know what I'm talking about. That stillness, that feeling right before the feeling you've been dreading. You know. You're not alone in what you saw. You're not alone in what you felt. And if they said something in those last hours that you never quite knew what to do with, hold on to it. I think they meant it. I've been a nurse for 20 years. I came up skeptical, and I'm going to stay that way. But I do not walk into a quiet hospice room anymore without listening a little harder than I used to, just in case.